Hey guys, this is Andrew Darlington with Veritas Risk Management. Today we want to talk about Obamacare. Everybody's talking in the news about what's going to happen with a repeal or replace, or what's going to happen from that standpoint. And I think everybody agrees that something does need to happen because what's happening right now is not sustainable. But the question is, what's going to happen? I've got my own ideas, so I'm going to kind of share some with you today. As you know, I've been talking about this since the very beginning, but it's because it impacts me. We've done a lot of health insurance, helped a lot of folks through the Obamacare process, so we've seen a lot of the good parts, a lot of the bad parts of it. And I think there's some things that are not being addressed right now that can be done. And so we're going to kind of talk about those today. The one thing that everyone I think agrees needs to happen is the costs need to be reduced. And I think one of the things that could easily be done is go back to the old way of health insurance, where there's individual underwriting based on your health. You have a rate. That just kind of makes sense. If you're healthy, then you're going to pay less because the insurance company is going to pay less and they're going to have to pay the doctors less. If you're unhealthy, you're going to pay more. But then that creates the problem of what do you do with folks that can't get insurance because they're uninsurable. And that's going to go into the second one, is give an avenue for the poor and uninsurable. There's got to be a way. In America, we've pretty much said, we're going to give you treatment. Regardless if you have money or not, we're going to make sure that you get treatment, at least stabilized. And sometimes even more than that. So people without health insurance are still getting treatment right now. It's just a matter of how they're getting that treatment done. So what I think that needs to happen is, one, we need to go back to underwriting. There's no, insurance companies can put out whatever policies they want to, and with more competition, doing it that way, you're going to have more opportunity and lower prices. Before Obamacare happened, there's about 6 or 7 individual carriers, maybe more than that wrote individual health insurance in the state of Tennessee. As of today, you've got basically 3, and you only have one in certain counties that are even selling the insurance. So obviously that hasn't helped create competition to reduce that. So if they would do that, that's going to create competition. It's going to reduce prices there. But we do have a big problem, and that is the poor and uninsurable. There's a lot of folks that even if they're healthy, they still can't afford health insurance or a higher deductible. So what do we do about those? We need to take care of those. As a society, we've said that. With Obamacare, it's already put the precedent there, so I don't think there's any going back on that. And I think from a moral standpoint, it's probably a good idea. Back in the day, a lot of churches did that. That's why you have a lot of Methodist hospitals, Presbyterian hospitals, and Catholic hospitals. They did that, but that's kind of changed now that we're in the 21st century. The other thing that I think, the main thing I think we could do to give avenue for the poor and uninsurable is to use the VA. I've taken some things here on the VA that you can take a look at. But if you, quick facts, this is from CNN, not my favorite network, but it is some facts. I also got some facts from the VA, and these actually work. But there's 18.8 million veterans in the U.S. So there's quite a few veterans. According to the most recent census, and the 2017 budget was $182 billion. So they've got a good sized budget. Who uses the VA and how big is it? The VA, and this was from NBC News, I think. The VA has 150 hospitals. So there's a lot of hospitals. There's 3 in Tennessee, actually 4. Nashville, Murfreesboro, Memphis, and Johnson City, as you all know. But there's also 820 community-based outreach centers, outpatient clinics, for other things as well. So it's not like if you don't live in one of those cities you can't get treatment. You can. And then there's 300 vet centers which offer counseling, suicide prevention, and some other services as well. What if we took the veterans, who are our heroes, who've done a lot of work, why don't we give them the ability to go to any doctor they want to? We know that the VA's had some problems with people not being able to get see doctors in times and that type of thing. These people have served our country. They put their lives on the line for us. Let's give them the opportunity. Let's give them something similar to Medicare, where they go to any doctor they want to. If they're qualified for it based on the VA guidelines, they would get all that free, just like they do at the VA. Under certain other situations, they have to pay some for that. And we can do it just like that, but give them access to every doctor in America, the best ones. If they put their lives on the line, why shouldn't they be treated as such? But now what do we do with the VA facilities? Well, we've got all these facilities. Let's let the poor and uninsurable go there. If you can't afford insurance, at least we got something for you. If you have a pre-existing condition and you can't afford health care, let's do this. By doing it this way, we're going to be able to control costs. We have already have a network of doctors. We already have a huge network of facilities and a huge budget of $182 billion going in there. If it's right now good enough for our veterans, it should be good enough for the poor and uninsurable. Because it is tied to the federal government, there could be, you could pay based on your income. If your income is extremely high, then you're going to pay more for this. If it's low, you're going to pay less. You can have a premium charge for this. And then when you go to the doctor, you have copays. You have it just like it is now through the tax credits and subsidies through Obamacare, but it'd be directly through the VA. That would allow the federal government to be able to control costs, so costs wouldn't be outrageous, and it would allow folks to get good treatment at a reasonable price and save everybody money. So just some thoughts there. I don't think that's in what I've been seeing. I haven't seen this discussed, and I think it's a very viable option. Certainly help our veterans and give them the treatment that they deserve. 5.69 million patients in 2013. If you look at the Obamacare numbers, I think they said somewhere around 8 million on Obamacare rolls. A lot of those people didn't go to the doctor this year, but 8.92 million enrolled in the VA healthcare system. That's about the same number that have enrolled through the marketplace for Obamacare in 2017. So that being said, the VA is poised to be able to take most of that. Now there are some issues with CHIP, the Children's Health Insurance Program, and some other things with Medicaid along those lines, but it's a great start. We know that with the VA, there's 18.8 million veterans, so that's a large number that they're trying to serve, and I don't think it'd be a far stretch to be able to get that there. If you have questions or comments on this, I'd love for you to post them. Let them know what you think, if it's a good idea, bad idea. Might be something you can take to your congressman or representative and see if that's something that they could fit in there. This wouldn't be an instant fix. It would be a transition over time, but I think it would be a good way long-term to be able to control costs, give the veterans what they need, be able to control costs for all the folks with health care. Because what's happening right now is you have the poor and uninsurable, and the healthy and the folks that can afford health insurance are having to subsidize that. With this, you pull that out, you put that through the VA, so those costs are contained, and then everybody else gets to pay a reasonable price for health insurance. If you look at one of my previous blogs, you'll see that health insurance rates in Tennessee have gone up 500% since Obamacare. 500%, that's huge. This would bring it way back down. People would be thrilled with 2 and 3% rate increases, or even a 20% rate increase now for that, but it would reduce those prices hopefully about the same, about 500% from where it was, and be able to make healthcare a lot more affordable. Again, I'm Andrew Darlington. We do health insurance. We can't do individual health insurance right now, but we do Medicare supplements. We do Medicare Advantage plans. We do group health insurance and employee benefits. We also do home auto and business and workers' comp insurance. So if you have any questions about any of that, give us a holler. We'd love to have your input. Thanks and God bless.